We came from all kinds of different backgrounds, social work and psychology and you name it, and a lot from the background of personal experience with either mental health or substance abuse of whatever sort. We had, I think, a certain set of tools, or a tool belt that had a lot of different pieces to it. We were always more than willing to share the tools with someone, but always ready to say to them, but the job is not ours. The job is yours. We're here to help. We're here to go with you. We're here to share experience. We're here to show you what other people have said works for them. But the job is not ours. The job is yours, but we'll be with you. We'll walk with you. We'll sit with you. We'll talk with you. We'll do whatever we can to help you change you.
I grew up in a very dysfunctional family, a lot of chaos. Was raised by alcoholics, and I had alcohol and drug throughout my entire extended family. So basically I became all I could become. You know, you are your environment. And so it just led me down that path at a young age. When I was 17, I got arrested, and back then there was an option between the military and prison. So I opted into the military, which kind of magnified my drinking more than anything, but I still drugged, you know, and I stayed in the Marine Corps for a good while, and that was like the only time I really like success. And then when I got out the Marine Corps, I just went right back into drinking and drugging and that whole criminal lifestyle, you know, selling drugs to supply my habit, to support myself. Had a couple of kids, you know, dysfunctional relationship, dysfunctional marriage, and just kept going in and out of prison. I don't know how to explain it, but you have that human connection. You know, there's a connection you have with people, but then you have that human connection where now you feel like, you know, maybe I'm really not that crazy. You can be taught some things that really teach you about yourself, and we would share the deeper things, you know, like the childhood traumas. People went through a lot, you know. So they were really small groups, and kind of like everybody trusted each other. And you share your story, and sometimes your story helps somebody else. There is a way, you know, out of this, you know, turmoil, or out of this mental thing that I'm going through, because you'll see somebody that went through it also, and they came out on the other side, you know. And the biggest part is when you share your stuff, you know, you get to find out like that what you believe is a hindrance is actually something that'll help somebody else. And that was one of the big things with me, you know. It's like I was extremely selfish throughout my addiction, you know. I was really selfish, and I think realizing that it's not about me no more, once I go through recovery and once I see that I have something to offer somebody else, it's not about me no more. You know, when I get up in the morning, it's not about me. It's about the people I'm gonna go see at the hospital. It's about my sons. You know, it's about being that example. Just by the way I walk, the way I talk, and somebody else will see that. You know, you help people unconsciously sometimes too. There's some very profound moments in treatment.
When a person comes in to help to Dempsey Services, they can expect that they will be treated with the utmost respect, with compassion, with care, that they will be part of our community. And it can be intimidating at first to think about, you know, what's it going to be like? Will I have a roommate? What will my day-to-day be like? And what I really want folks to know is that initial feeling of discomfort, which, you know, is human. It's part of not knowing exactly what to expect, and will I be accepted, and will I be asked to talk about things that are really hard for me to talk about. We work with every person to have that journey be directed at the pace and comfortability of the person who is walking it. And we will walk it alongside you. We've been doing this for a long time. We recognize that initial discomfort. We recognize that this is some of the most important work that a person can do, and that journey requires courage, and that as you discover who you are and you find that love and self-acceptance, those connections in that community, that's the transformational part of finding recovery and freedom.